How's it going, everybody? As the show continues on now, I'm Jeff Slakey, and I'm talking today with Jennifer Anderson, the Director of Care Coordination for Mason Health, about some upcoming things that folks over 65 will start seeing in the mail. Good morning, Jennifer. How are you doing?
Good morning. Good. How are you?
I'm well. Thanks for talking with me about this Mason Health unveiling free Medicare Wellness Program. If you're turning 65 or have reached that milestone, there's some new opportunities for service from Mason Health. Let's talk about that.
It's great. We're offering a wellness appointments, either if you're just turning 65 or you've been 65 and there's an annual wellness. It's really, the focus for it is preventative medicine. So for Welcome to Medicare, it's how to navigate through our system. It can be hard. And we have MAs who first, when you set up an appointment, they go through and they scrub the chart and they determine what you need preventatively. So a mammogram or a DEXA scan, they'll let the nurse know and then get it scheduled, which is wonderful for our patients. And then we'll have a pharmacist review each chart and determine if your medications are accurate for you or if there's an issue. If there's an issue, he will want to meet with you when you come in for your appointment to discuss it with you. And then finally, the RN will interview you when you come in that day and talk about what's going on with your health, what strategies you have, what outcomes you want to improve, and send you on to a care manager for hypertension or quitting smoking or anything that you want to work on. It's really to put the power of your health in the patient's hands.
We've seen reports over the last 3 years now, I guess, that we've been living through COVID, that folks have at times foregone going to the hospital in concerns for their own health and safety. And sometimes you hear stories about ways that if they had gone to get some of even these starter checkups, things would be found and plans could be implemented to help correct those. You've seen those as well?
Yes, definitely. It's true that without the preventative testing and screening or advanced care planning, that's another thing that the RNs will work with them on. You end up in the hospital, you don't know what your plan is, what you need to have done for you. So taking this time out to say, let's really square the patient, get them centered, and strategize about how to have healthy outcomes is huge.
Talk to me a little bit about what the patients would need to have to be able to access this. Is it part of the Medicare programs, Medicare A or Medicare Part B?
It's actually Medicare Part B. So what most people don't know, and we see this when they go into the hospital too, is that they say, okay, Medicare pays for hospital visits, this is fine, but Medicare A is only for inpatient and Medicare B pays for outpatient. So most people think clinic, but that's actually the hospital observation stay as well, or having surgery and staying in the hospital. So it is free for those who have Medicare Part B, but we need to clarify it is Part B that you're signed up for.
Sure. And as people turn 65, they'll start to see different documents come into their mailboxes about signing up or being eligible for these different programs?
They will. They'll see different. Aetna offers a program, United Healthcare offers a program, Kaiser offers a program, and we offer a program too. So that's very true.
What's the concerns that you may have for a population that may have not been into a hospital for a while, or if folks foregone any health coverage or care leading up until 65, and then when they show up there at your doorstep to start this process?
So I think the problem that I've seen through the years is that most of our people do not know how to navigate the health system, period. And when you're in an acute need, it's not the time to learn. The time to learn is when you're at home, doing well, making a preventative appointment, and then we can coordinate with different people on our team. So whether it's the pharmacist looking at your medications, or if the nurse identifies you have transportation issues, we can give them resources. We can print them up, give them to them. And then if they still think that there's additional help that's needed, which is, everything's computer these days, so that can be helpful, she'll forward it to our community health worker, who will then call the patient and work through that slowly with them. So it's really to ease the navigation.
We're coming to the end of January, start of February here. Are these programs starting now, or should folks start to call now and get scheduled for end of the month or next month?
So they are starting this Friday, but they'll really be, you'll see postcards coming out in the mail for February. That's when we'll say, hey, we've noticed that you're due, come in for your welcome Medicare or your annual wellness. And this is not to confuse patients. So there was an annual wellness that some of our providers performed, but this is a new path that we're going.
Okay. And then finally, let's talk a little bit about some of the continuing precautions and protections that are at Mason Health as people are to come into the hospital and start this. Masking, of course, is required. You shouldn't come in if you have, temperatures and things like that.
And we have the questionnaires when they first come in to find out if they have had COVID symptoms. Yes.
Okay.
Yeah, we're taking every precaution. We are.
You can go to masongeneral.com /services/Medicare Wellness on the website. There are links as well here to find more about this as it comes on board here in the next week or so, with postcards and flyers coming into your mailbox soon if you are eligible for these programs. I'm talking with Jennifer Anderson, the Director of Care Coordination for Mason Health. Is there anything more that you'd like to leave the audience with right now on the benefits of this preventative care?
I would say the thing you want to do is get everything checked out immediately while we've got the team, while you've got the pharmacists, the RNs, the providers all working together for your care. This is a huge benefit to you. And the other thing I would say is that we are sending out postcards. We will be calling you to schedule, so you don't need to worry about calling us. And if you haven't heard, then next time you're in, you can talk with your provider about it.
Great. Jennifer Anderson, again, the Director of Care Coordination for Mason Health. masongeneral.com is a website where you can start and find a lot of great information about this and other things that are happening with Mason Health. Jennifer, thanks for coming on and talking with me about this.
Thank you, Jeff, very much.